any couple coming to you and they are requesting for the investigation as they feel that they are not able to conceive. So, what is the definition? When they should be advised to be investigated? So, basically, infertility is inability of the couple practicing frequent intercourse and not using contraception, and they are if not able to conceive a child, then it is called infertility. Now, practicing frequent intercourse is very important because in today's lifestyle, many times they are staying together, but their frequency of intercourse is very less. Husband is doing night duty, wife is doing day duty, so they hardly meet, maybe once in a week or something like that. So then they should be given adequate chance, and you should make them understand that what is the ideal frequency. So what is the ideal frequency of the intercourse if any couple wants to conceive? If they are covering a fertile period, then there is no problem. So first of all, you should give them knowledge about the fertile period. What is the fertile period? If they are not covering the fertile period and all throughout the month, if they are practicing intercourse at least 3 times in a week, this frequency suffices for the conception. Now, if the age of the female is less than 35 years and the couple is not able to conceive after unprotected intercourse even after 1 year, then this couple requires investigation and treatment. But the things are different if the age of the female partner is more than 35 years. Because we all know as, as the age advances more than 30 years, the egg quality starts declining. From 34 to 37 years, the decline is very sharp, and after 37 years till 40, it is a steep decline, and after 40 years, it is really difficult to conceive for a woman with her own eggs. Mind you, this is a Western data. The Indian data says something else. Whatever is happening there at 30 years, here it starts happening 4 to 5 years earlier. So, in Indian scenario, we should be more careful about the age of the female partner. Now, while taking the history, if you notice that the female partner is not getting regular menstruation, or after investigation, if you come to know that the husband's semen is compromised, then the couple should be advised to investigate and avail treatment for their problem without undue delay, even if they have come to you 2 months, 3 months, or 4 months after the marriage. Now, what are the different types of infertility? The couple who has never produced a pregnancy, never conceived, not even abortion, no ectopic pregnancy, then they are suffering from primary infertility. But the woman who has previously been pregnant, regardless of outcome, and now she is unable to conceive, she is labeled as secondary infertility. By and large, the treatment of the secondary infertility is relatively easier and prognosis is better because the woman has proved the machinery is working perfectly, but because of the some reason she has conceived and now she is unable to conceive. Now, what are the causes of infertility? If you look at broadly, the female partner is responsible for the 40% of the cases. Male partner is responsible solely for 40% of the cases. In 10% of the cases, maybe overlapping, both male and female partner responsible. And in 10% of the cases, with routine investigation, we are unable to find any cause precisely, and these couples are labeled as unexplained infertility. I would say it is undiagnosed infertility because there are several reasons, maybe fertilization problem, maybe some minor sperm problems, maybe some peritoneal disorder, maybe mild pelvic adhesions, maybe mild endometriosis, which are not detectable by routine examination and investigation. They are grouped as unexplained infertility. If you go further into detail about the female factor, out of the female factor, 35%, roughly one third of the cases are ovulation problem. Another one third cases are tubal problem. In 20% of the cases, peritoneal causes like tuberculosis, pelvic adhesions, endometriosis may be responsible. In another 5 to 10% of the cases, uterine problem like anomaly of the uterus or maybe polyp or maybe submucous fibroid responsible for the infertility. And very rarely, in 5% of the cases, vaginal or cervical causes may be responsible for the infertility, like cervical erosion, cervical polyp, chronic cervicitis, vaginitis may be responsible for a very few number of the cases. There is increased rate of anovulatory infertility because of the increasing incidence of PCOS. PCOS is lifestyle disorder. It is related with the stress. It is related with the obesity. It is related with the junk food. So the incidence of the PCOS are increasing day by day. Now coming to the tubal causes. The tubal cause infertility is also on the rise because of the increased incidence of pelvic inflammatory disease. The reasons behind the increased incidence of the pelvic inflammatory disease: commonly repeated abortions, MTPs, sexual promiscuity, repeated sexual exposure by multiple partners, unhygienic conditions, tuberculosis, endometriosis may be responsible for tubal infertility. Now coming to the male factor, in 40% of the cases of the infertility, male husbands are responsible. Normally, when couple comes to you, normally husband are very much reluctant to accept the fact that 40% chances, 40 to 50% chances are there that semen sample may be compromised. So you have to counsel them properly, and semen analysis should be done on first visit only. There are 10% of the cases where male and female partner both contribute to the infertility. In 10% of the cases, the causes we are unable to find out and they are labeled as unexplained infertility. Now, in infertility, when we are able to pinpoint the reason, we are always happy because diagnosis is in our hand. If we take care of that particular problem, the chances of success are very high. But if it is unexplained infertility, the treatment aim is really difficult. We do not know what to aim. And whatever you do, the chances of success, except IVF, are not more than 10 to 12%. So these are this group of the patient. Once you say them that you are suffering from unexplained infertility or we are unable to find out the reason, they interpret that they do not have any problem. So they become overconfident, and it then this fact damages their prospects of fertility treatment. According to me, the unexplained infertility is the most difficult reasons to treat. So they should be given adequate chance of non-IVF treatment, maybe for 6 months or 8 months. And after that, if they are unable to conceive, IVF should be advised immediately. Now coming to what are the causes of male infertility. There are certain conditions like varicocele, obstructive azoospermia, which are pretty reversible. You can expect improvisation in the results. The semen quality may be improved if that particular conditions are taken care. But there are certain non-reversible conditions. But the ray of hope is there. The viable sperm may be available, like ejaculatory dysfunction, inoperative obstructive azoospermia. There are certain conditions which are non-reversible and there is no viable sperm available, azoospermia. There are certain genetic disorder responsible for abnormal semen parameter. That can be a testicular or pituitary cancer which causes abnormal semen parameter. Now if we come across the tubal or pelvic pathology, we must know what are the conditions which causes tubal or pelvic pathology. There are certain types of congenital anomalies which can be responsible for infertility. Maybe hypoplastic uterus, small uterus, maybe unicornuate uterus. There are cases where there is occlusion of the tubes and there is always a altered peritoneal milieu along with the occlusion. The tubal occlusion may occur as a sequelae of pelvic inflammatory disease. The chlamydia is a principal etiological factor for PID. which can damage the tubes. Endometriosis. Any abdominal or pelvic surgery which is done before can give rise to pelvic adhesions, which can obstruct the tubal passage, which can kink the tubes, and which can cause tubal occlusion. Any history of peritonitis, recent or past, can leave behind damage in the form of adhesions, which can also kink the tubes. Now coming to a ovulatory dysfunction. The patients who are having ovulatory problem are most of them having irregular menstrual cycle. But it is not necessarily has to be irregular. Even if the patient is getting regular menstrual cycle, maybe 20% of the cycles are anovulatory. But if the cycles are irregular, most of the times they are anovulatory cycle. The commonest problem responsible for ovulatory dysfunction is PCOS, polycystic ovarian syndrome. Another common ovulatory dysfunction are hyperprolactinemia, thyroid disorder. Patient may be suffering from hypothalamic hypopituitary anovulation. Patient may have premature or age-related ovarian failure, or patient may have just luteal phase defect. So we have to consider into account so many things when we are investigating ovulatory dysfunction. Even hyperandrogenemia needs to be investigated because it directly and indirectly affects ovulatory function. Thank you.